Hi, everyone. My name is Kerry Mulcahy. I'm a fourth year doctoral student at Montclair State University. The title of my research study is Understanding the Effects of Different Cognitive Processes on Speech Perception and Noise for Normal Hearing Middle-Aged Adults. The head of my committee was Dr. Wambach, and the committee members included Dr. Kinke and Dr. McInerney. All this took place on campus at Montclair State. A person's ability to process speech is extremely difficult in the presence of background noise. This could be for people with hearing loss as well as for people with normal hearing. Um, we a lot of times see in clinic and in different clinical settings, middle-aged adults come in saying, I have difficulty understanding speech and noise, such as a bar or a restaurant setting, or even a work office type setting with different kinds of background noise. Many times we'll do their hearing test, and their hearing test many times can come back normal, and we're kind of not giving them any answers, and they're leaving without their original complaint addressed of difficulty understanding speech and background noise. The middle-aged population may experience these difficulties due to the potential aging status of their cognitive skills. Um, these cognitive skills can include working memory, that ability to update information as it comes through, semantic knowledge or a person's vocabulary skills, reading comprehension and reasoning, divided and sustained attention, decision making, inhibition and switching, processing speed, and executive function. Executive function is controlled by our frontal lobe and helps out with all different cognitive skills and other aspects such as time management skills. Our study included 10 middle-aged adults ranging from age 40 to 60 years. These subjects were 5 men and 5 women with a mean age of around 57. They all had normal hearing, 250 to 4,000 hertz, which was determined by a hearing screening done that day. The study was approved by the MSU IRB, and all subjects signed a consent form prior to testing. In our study, first, each subject was given the Speech and Spatial Qualities 12 questionnaire, the SSQ 12. It's basically a questionnaire or survey screening, and it looks at a person's perceived ability in different listening situations. It was originally used for people who have hearing loss or who have hearing aids, and this could be done pre and post fitting, but it's basically looking at their ability in different situations. Some of the questions include, are you able to understand someone is talking while the TV is on in the background? Or how are you when you're at a restaurant and there's different people talking around you? Are you able to concentrate and understand the person across from you? They labeled their perceived difficulty 1 through 10, 1 having extreme difficulty, to 10 having not a lot of difficulty in that situation. And it was scored out of a possible 120. So this way we are able to see a person's perceived difficulty understanding speech and noise. Then it included 4 cognitive tests. The first cognitive test is the IEEE. It was 40 sentences at different signal to noise ratios, at -6, -3, 0 dBSNR, as well as in quiet. They were the number of words correct was scored in each condition, and this way we were able to assess each subject's speech comprehension and noise ability. The next test is the Boston naming test. It's a book of 60 black and white drawings, and the subjects are asked to name each item. This will test the cognitive skills of vocabulary and semantic knowledge. The third test is the reading span test. This was done on an iPad. And basically sentences come across the screen with different millisecond gaps between them, and subjects are asked, does the sentence make sense? And they are also asked to say the first or the last word of the sentence. We are looking at their semantic processing and their storage ability, but the reading span test research has shown to assess working memory and executive function skills. So two very important skills to understand speech in background noise. The last test is the trail making test. This was comprised of two parts, part A and B. Part one, subjects are to label points 1 through 25 without removing the pencil from the page. And part B, subjects were asked to not only label it 1 through 25, so a numerical order, but as well as alphabetical order. So, for example, it would be 1A, 2B, 3C. The total time for this was measured, and this was to assess sustained attention, inhibition, and switching and processing speed. So the SSQ and then these four cognitive tests is what made up our battery. The results that we found correlations between the SSQ, the SSQ 12, so their perceived difficulty understanding speech and noise, their results on the reading span test. There was also a correlation between their scores on the IEEE at 0 dBSNR and their perceived difficulty understanding speech and noise as assessed through the SSQ. And the last correlation we found was between a subject's scores on the IEEE at 0 dB and their reading span test scores. So the correlations that we found were between that questionnaire, the SSQ 12, results on the reading span test, and scores of the IEEE at 0 dBSNR. The goal of our study was to look at the association between a person's perceived speech understanding and noise and their cognitive skills. So we found that subjects with the worst SSQ scores performed the worst on the IEEE sentences at 0 dBSNR. So the worse they perceived their difficulty understanding speech and noise, the worse they did on a test of speech comprehension. Then we also saw that listening and noise relies on working memory and executive function skills. That reading span test specifically targets an individual's complex working memory, and this takes about 20 minutes to administer. Complex working memory allows people to store and process information simultaneously. So since the SSQ correlated with the IEEE at 0 dBSNR, as well as scores on the reading span test, this suggests to us that the SSQ questions may be tapping in to what the IEEE and the reading span tests have in common. So overall, this study showed that individuals with normal hearing and normal performance on IEEE sentences can have speech and noise difficulty due to decreased working memory skills. And these working memory skills were assessed through the reading span test. This study showed that a quick assessment of the SSQ 12, which was previously used for people with hearing impairments, can evaluate a person's difficulty listening in noise. And it also can assess their working memory and executive function skills due to the correlation we found between a subject score on the reading span test and their perceived difficulty understanding speech and noise. The SSQ can assist clinicians in making better and more appropriate recommendations. The SSQ 12 is very quick to administer. Many times it's unrealistic to administer a cognitive test battery to every patient that comes in complaining of difficulty understanding speech and noise who have normal audiograms. But a quick assessment of the SSQ 12 questions, we can look at their working memory and executive function skills. So by determining their working memory and executive function skills, we can make better and appropriate recommendations. We can recommend the use of a low gain hearing aid. We can recommend cognitive skills exercises and make those appropriate referrals for them to leave without their complaint being addressed. So in conclusion, this study examined cognitive skills and perceived difficulty listening in noise of middle-aged adults. A subject's performance on the reading span test, which assessed a person's working memory and executive function skills, correlated with their perceived difficulty understanding speech and noise. So that correlation between the reading span test scores and their scores on the SSQ, that correlation can be used in clinical diagnosis going forward. This result can assist in clinical diagnosis and treatment. And as I said, it's unrealistic to administer this whole cognitive test battery, but we can do a quick 12-question survey to examine their difficulty understanding speech and noise. Scores on this questionnaire can give clinicians a better idea of their working memory and executive function skills. And the goal is to just be able to treat patients fully and to give everyone an option before they're leaving. So that was the purpose of my study, just to look at a person's perceived difficulty understanding speech and noise and a person's cognitive skills in the middle-aged population. Thank you so much.